Hello and welcome everyone. My name is Fabio Castellana and I will be your host and the moderator for this webinar today. I'm a senior consultant on climate change adaptation and really excited to be here with AfriCatalyst and to moderate this great event. Before we begin, I wanted to share with you some housekeeping rules and guidelines so that we all have a smooth and exciting and engaging experience throughout the webinar. So please also join us through the Zoom app for the best experience in order to better use all the features that we prepared for you to have an engaging conversation also with the panelists through breakout rooms and interpretation. Please join us through the Zoom desktop app or the mobile app, not a browser. Language and interpretation is available from English to French and Spanish. To use this feature, please click on the interpretation icon on your Zoom toolbar and select your preferred language. After selecting your language, please mute the general room and only leave translation audio open. During the session, we will have some breakout room discussions. So we will start with the panel and then we will be moved on breakout rooms. I'm going to talk about them later. You will be automatically assigned to a room. There will be 2 rooms for English speakers and 1 room for French speaker. In one English room, there is also going to be translation to Spanish to allow the engagement of our colleagues from Latin America. If you experience any issues during the webinar, please use the chat box. Our team will be on standby to support you. And I wanted to use this opportunity to thank all the AfriCatalyst team that organized this amazing webinar. Without you, this event would have not been possible. Please keep your microphone muted. Kindly use the raise hand feature. And also please note that this webinar is being recorded. By participating, you consent to the recording being used for documentation and reporting purposes. Finally, I wanted to share with you that we will be launching with AfriCatalyst some policy papers on the nexus of climate and water, climate and health, and climate and nutrition. So please be on the lookout for these papers. The link will be shared in the chat during the webinar. So this part was not the most exciting, I know, but it was very much needed. And before going to our panel, I wanted to invite Dauda Semben, the CEO of AfriCatalyst, to give us some words of welcome to set up the stage for the webinar.
Well, thank you very much, Fabio, and thank you for your great work. Good morning, good afternoon, everyone, and welcome to this webinar. Maybe before actually making my remarks, let me quickly introduce AfriCatalyst. AfriCatalyst is a development advisory based in Dakar with an office in Nairobi. And we strive to support African countries, African stakeholders in their efforts to mobilize financing for development and climate. And we do so through a various ways, whether it's research, whether it's advisory, whether it's advocacy, or whether it is capacity building. But today, we are very much delighted to organize this South-South webinar to discuss about issues that are extremely critical, as many countries in Africa, in Latin America, and around the world are working on the implementation of their national adaptation plans, but also their nationally determined contribution. So what we felt and what we realized was that there is an intersection of climate adaptation, health, and nutrition that was extremely critical, but unfortunately that were not explored enough. So yet we all understand that actually addressing those linkages are important for making sure that climate policies are very much equitable and effective in promoting long-term resilience. So what we at AfriCatalyst thought would be helpful is to have a gathering, a convening like this one, where we would give the opportunities to stakeholders in Africa and stakeholders in Latin America to very much interact and exchange knowledge about how we can address these issues in the best way possible. how we can share success stories, how we can, of course, identify opportunities and challenges in efforts to integrate health, nutrition, and climate adaptation into those national adaptation plans and nationally determined contribution that I talked about. So without any further ado, I'm going to actually let Fabio take it over from there. But before, je voudrais souhaiter la bienvenue à tout le monde à ce webinaire qui est organisé par Africatalis, un cabinet de conseil et d'études qui est basé au Sénégal et qui vraiment essaie de tout faire pour appuyer les efforts dans les pays africains à mobiliser des financements pour l'action climatique, mais aussi pour le développement. Et nous vraiment valorisons beaucoup les échanges d'expériences. Et à travers ce séminaire, notre objectif et notre ambition, c'est de faire en sorte que les experts de l'Amérique latine, mais aussi de l'Afrique, puissent échanger sur les bonnes pratiques pour vraiment s'assurer que les questions d'adaptation climatique, mais aussi de santé et de nutrition sont bien prises en compte et intégrées dans les plans d'adaptation nationaux, mais aussi dans les contributions nationales déterminées. Donc, vraiment, sans plus tarder, je vais laisser la parole à notre modérateur Fabio, qui va guider les débats. Et nous avons hâte d'écouter les experts que nous avons pu réunir, aussi bien de l'Amérique latine que de l'Afrique, mais surtout aussi écouter aussi parmi les gens qui sont dans l'audience et qui ont beaucoup de choses à partager dans cette perspective. Donc, merci beaucoup et encore bienvenue et merci d'avoir pris le temps de participer à ce webinaire. Au plaisir de continuer ces échanges dans le cadre de ce webinaire. Thank you very much. Fabio, over to you. Thank you.
Merci, Dauda. So thank you so much. And as usual, really on point. Thank you for these great remarks. And Dauda really highlighted the objectives, right, of this webinar, which is the idea at the basis is really to exchange success stories, opportunities, but also challenges, and how people manage to get over these resolve these challenges. To discuss this, we will invite 3 panelists to join me in this conversation. I will ask them one question and represent them in a moment, just to give you some idea of the structure of the webinar, but you in this moment will not be able to ask them questions. For that, we prepared some breakout rooms in which you will be able to interact with them more closely and also to share your experience and really in the Nexus and also ask them anything that you think fit. So our panelists are Solomon Layer. Solomon is a senior budget analyst from the Ghana Ministry of Health, who is contributing to multi-stakeholder public health projects that strengthen adaptation to climate-induced health risks. He supports budgeting and planning for integrating initiatives addressing climate resilience, water security, and nutrition access. Welcome, Solomon. The second panelist that we have is not from a government, is Bertha Lilian Mkandwire. Bertha heads the Nutrition Sensitive Agriculture program at the Alliance for a Green Revolution in Africa, short for AGRA. She's also a PhD candidate in food systems and rural development, and she champions climate resilient food systems that bolster nutritional outcomes across African communities. Finally, we will be joined by a guest from Latin America, Katia Aguilar Martin. Katia is a chemical engineer in Costa Rica, and she is working in the Climate Change Directorate within the Ministry of Environment and Energy, short for MINAE. She leads the coordination of national climate policy, including carbon neutrality strategies and interministerial frameworks, linking environment, health, and agriculture. Welcome, Katia. So that said, I will invite our panelists to turn on their video. And in order to start the discussion, I wanted to ask Solomon a question, really trying to understand from your perspective, from Ghana's perspective, how has the health sector, as you work in the health ministry, been engaged in national climate adaptation planning so far? And what have been some of the key challenges and solutions that that you know of in ensuring that health considerations are meaningfully integrated into climate policies?
Yes, thank you very much for the question and the opportunity for this cross-country experience forum. In Ghana, I think we've done very well. We have a well-structured system in terms of climate change adaptation planning, right from the health sector, where we are to develop our adaptation plan. In Ghana, we call it the Health National Adaptation Plan, and the adaptation plan should be scientific, and so the evidence for the adaptation plan is the VNA. In Ghana, the VNA, we conducted it across all 16 regions. We went as low as communities, districts, sub-districts, and then also some selected health facilities to bring out the risks, vulnerabilities, and adaptive options that were fed into our HNAP. After developing the HNAP, the next level is the National Adaptation Plan for the whole country, and it's coordinated by the EPA. So the EPA brings together key stakeholders, health, energy, environment, and then we are to do a reprioritization of the key actions in our sector-specific plans. So in the health sector, in terms of our prioritization, what we are putting at the national level, we are looking at four broad areas. One, building capacity for health workforce, improving surveillance on climate-sensitive diseases, and then climate finance, and then also looking at decarbonization of our infrastructure and supply system. That is for the national level. And then the next level is the NDCs, which is coordinated by the Ministry of Environment, Science and Technology. We are yet to have that discussions at that level, but with previous experiences, the health had about 2 actions in our NDCs out of 47. And this is quite worrying. The second nature is that health has been tagged as only adaptation or adaptive in nature. But we all know that beyond the adaptive nature, the health sector is also one of the largest sectors contributing to greenhouse gas emissions. So we also play a key role in mitigation, and so decarbonization of the health sector is very health sector and supply chain is very key for us. And this time around, we are looking at having engagement with them, moving from just 2 actions to 5 actions, and then also having actions on both the adaptation and mitigation, because in Ghana, majority of our financing is on mitigation, even though we are doing adaptation. And so we are pushing to get some adaptive, some mitigation actions on health to get support. In terms of the challenges, the first one is financing. When you have a structure like this, majority of the financing is concentrated at the top level. So you are having MESTI, which is conducting the NDCs, and then EPA, which is doing the NAP, having all the government support, and then also the donor support from UNDP. But when you come to sector specific, especially we in health, we don't get government support. So majority of our work is being sponsored by donors. So right from our VNA to our HNAP, we are having WHO, UNICEF coming to our aid. And when we talk about sustainable financing, I don't think that's the way to go. We have to move from donors sponsoring fully to get government support, trickling down from the top to us. Another key challenge that we also will face is in terms of capacity. You and I know that VNA and HNAP is a scientific process. So if you don't have the capacity, you can also conduct it. And so we need to build our capacity. But I must say that we've also done very well in that aspect. For the first time, our VNA and our HNAP was conducted by the ministry, where most countries bring in consultants to come and do their VNA assessment for them. But for the first time, we set up the technical team. We got training from WHO, and then we conducted our VNA comprehensively and our HNAP without support from a consultant. And then also, right after the VNA, we are currently developing our health sector medium-term development plan till 2030. and we are looking at climate change being a thematic area in our health sector development plan. And this is the first time we are going to see climate change and health as a thematic area in our health sector medium-term development plan. So that is also a good step. So in terms of the way forward, we are looking at trying to advocate to get sustainable financing for climate change and health. Even though there's sustainable financing for climate change at the national level, you see energy, you see transport getting all the support from the government. Health has been left out, and we are looking at getting sustainable financing from that. We are looking at engaging the Ministry of Finance in the Ghana's Ministry of Finance to advocate, to sell our case to them to get support. We are looking at building our capacities so that, because VNA is also conducted 10 years or at best 5 years. So once we build beyond also do your VNA and your HNAP, the implementation of the actions are also very, very key, both in your sector specific and then also in the NAP and then the NDCs, how we can be able to implement those actions to that. So we are looking at that. And then also we are looking at promoting low carbon health systems as part of the mitigation effort. So I think broadly, this is what we are doing. These are the challenges, then these are the way forward. Thank you.
Thank you so much, Solomon. It was amazing, really, so much to unpack, and I'm sure that our attendees are going to ask you a lot of questions. I personally have some, but I will reserve it for later. So I will give. I have another question though to our other panelist, Berta, because you bring a different perspective, right? So Solomon spoke about the different structure that the Ghana's government put in place in order to consider health in a different level of climate policies, but you work in a different context, right? So in your work at AGRA, what promising approaches have you seen for linking, in this case, nutrition, which is your specialty, and nutrition outcomes with climate resilient agriculture, and how can these be scaled through national adaptation policy frameworks?
All right, thank you very much, Fabio. I think before I get into the nutrition space, I just want to quickly give some insights of how our continent is performing right now in terms of nutrition. African continent is the only continent that is lagging behind on a lot of nutrition indicators and outcomes. And as a continent right now, we are faced with a situation where 70% of our people cannot afford a healthier diet. We are faced with a situation where non-communicable diseases, which are diet-related, are increasing. We are faced with a situation where the wall on stunting and other childhood indicators on malnutrition, we are not doing very well. Now, all this is compounded right now because of the issues of climate change as well. Climate change is a big threat to the quality and quantity of the food that we produce on this continent. So looking at nutrition, climate change, and health outcomes, we can't really separate these three. We really have to ask ourselves to say, if we're going to look at nutrition, we have to look at nutrition outcomes from a multifaceted kind of approach. So we're looking at agricultural productivity in the face of climate change. As I speak, scientific research is showing that a lot of staples right now under climate change are losing micronutrients like zinc that are in staples. And remember that on our African continent, 60% of our calories come from our staples. And our food is calorie dense from staples. And now if the same staples are going to lose right micronutrients that are important for human development and growth, then we're faced with a bigger situation. So climate change in terms of nutrition is not something which is very distant. It's actually very, very critical. So now when we are looking at designing nutrition interventions, we don't do that in the outcome form only. We do it in the process form to look at it to say what is affecting nutrition right now on the continent. So climate change adaptation becomes a very key aspect for nutrition. And I'll tell you this, if we put nutrition lens in climate adaptation, we'll gain more, because from a nutrition lens, what we basically look at is diversity. So for nutrition to be achieved, for a healthy diet to be achieved, you basically have to have fruits and vegetables and legumes. Every food group has to be there. And if farmers are going to diversify their farm productivity to look at this kind of diversity, that will increase biodiversity at farm level, and that supports nutrition, that supports climate change. So what AGRA we are doing is we have frameworks that we use to mainstream nutrition in our investments, because we look at every investment that we make as AGRA to support farmer productivity has an opportunity to support nutrition outcomes. So these frameworks don't only look at nutritional goals, but they look at how does other factors affect nutrition outcomes. So in the face of climate change, when we work with our sustainable farming and climate resilience unit, we actually challenge to say any kind of investment we are making, we are looking at regenerative agriculture, we are looking at soil health, we are looking at branded fertilizer, we are looking at all aspects that would support climate resilience. And building climate resilience from a nutrition angle, as I said, it has more benefits, because then you are looking at a diverse diet. And if we are struggling as African continent to feed our people in a way that we have still 70% of our people not affording a healthy diet, it all boils down to the way we design our interventions, our framework. So national adaptation plans, if they have a nutrition goal in it to say, okay, in this adaptation we are aiming to achieve so much biodiversity for nutrition, you will we will see that that adaptation is not only looking at environmental health of the planet, but it is looking at the nutrition aspect as well. So we have programs here in AGRA that support that. We have just launched a food loss program under climate resilience, where we are looking at how do we support food loss as well as nutrition outcomes. The more we invest in food reduction, Africa loses 40% of our food due to food loss and food waste. And that's a lot. That's a lot. So we are trying to reduce that aspect from a nutrition lens. So we are employing frameworks or technologies where we are even promoting whole consumption, where the lesser you process, the lesser food you lose, and the lesser demand you place on the environment, on the earth for more and more production. The more we produce without taking care of what is already produced, the more pressure we're exiting. So we're looking at all that. And now, from this webinar, I think for me is for us to reflect, to say, what would we really focus on in terms of national adaptation plans? Those plans should really support nutrition outcomes. And along that, when we are focusing on nutrition and nutrition outcomes, the healthy diet, the healthy food environment, we are actually demanding on ourselves to do better in terms of what we are producing, how we are producing, how we are distributing. So I think I would look at that from that, and what AGRA is doing under REGAIN, which is a purely climate adaptation project, and which we aim to look at it from nutrition outcomes, supporting non-communicable diseases reduction through whole food consumption. Thank you.
Thank you. Thank you so much, Berta. So many, again, also insights and really concrete actions. And I think it's really important your presence here also to showcase this tension, no, between the plans, the implementation, the need for action, and, as Solomon already mentioned, the need for finance. And another thing that Solomon mentioned, and that's great that we have Katia here, is really about the data, right? Costa Rica, Katia, and that's a question for you. Costa Rica has long been at the forefront for climate smart, not only climate action, but also climate smart sustainable development in a way. So I wanted to ask you, because you're an expert also on data, and how is your ministry working to incorporate science-based actions and public health priorities, including the use of data, into climate adaptation planning?
Thank you. First of all, well, I want clarify that I used to work for the Climate Change Directorate, but right now I'm working with the National Meteorological Institute, because since the 90s, it's been the institution in Costa Rica that has been developing the different national greenhouse gas inventories. Well, those inventories actually are the ones that we use as our baseline to implement or develop the different policies and strategies in Costa Rica. Our main pollutant or emitter in Costa Rica is the transport sector. Also, we have huge challenges on waste management and the agricultural sector. We have been developing also different guidances for different levels of reporting for our system, that is the CINAMEC, that is the climate change metric system that we have in Costa Rica. We try that the different levels of implementation of mitigation actions and adaptation actions report on that system. We have, for example, the carbon neutrality program, where different organizations from the private sector report their inventories and the different actions that they are developing on mitigation adaptation actions. Also, we have been developing actions with the coffee sector, cattle, bananas, sugarcane, rice. The national appropriate mitigation actions, which also include adaptation actions that contribute to the soil health. And also we have actions by the local governments that also have guidances for circular economy actions. Well, just to make a bit of a summary of the different actions or the intricate relationship between health and climate change, I want to share some compelling insights from our experience. A nation that, as you well said, is recognized for its progressive environmental policies and its unwavering commitment to sustainability. We try to offer a case study on how our country can proactively address the health impacts of a climate changing of the climate change. Its approach provides valuable lessons across several key areas. First, we can look to our efforts in food security. Climate change poses significant threats to agricultural systems, directly impacting the availability and accessibility of nutritious food. Despite these challenges, Costa Rica has been focused on building resilience into its food supply, implementing strategies that ensure its population has consistent access to health sustenance, even in the face of environmental shifts. Also, we have been implemented nature-based solutions. These innovative approaches leverage the power of ecosystems to address societal challenges. Sorry about the dog back there, including those related to climate change and health. With its rich biodiversity, Costa Rica has been at the forefront of implementing solutions like reforestation, sustainable land management, and coastal protection. These initiatives not only mitigate climate change impacts, but also yield significant health benefits for communities. I would like to highlight the critical issue of air quality. As we know, climate change efforts often intersect with improvements in air quality, which directly impacts respiratory and cardiovascular health. Costa Rica's strategies for maintaining and improving air quality are a key part of our health agenda. It's crucial to understand the very real costs of poor air quality on public health, the economic and social burdens underscore the urgency of effective air pollution control, a lesson Costa Rica has taken to heart. If an air quality improvement plan were implemented to comply the WHO regulations in our great metropolitan area, a total of 229 deaths per year will be avoided in the long term. That represents 3.45% of all deaths for people over 30 years of age. And finally, I want to touch on a specific health and climate change studies related to vectors, with particular focus on diseases like dengue. Rising temperatures and altered precipitation patterns are expanding the geographical range and transmission sessions of vector-borne diseases. Costa Rica has been actively researching and implementing public interventions to combat these growing threats, providing valuable lessons for other regions facing similar challenges. Climate change exacerbates the risk of dengue as shifting sessions, increased humidity, shifting seasons, I apologize, increased humidity levels and fluctuating temperatures create more favorable conditions for Aedes aegypti mosquito.
Yes.
And these rainfall patterns are particularly correlated with dengue hemorrhagic fever.
Yes.
These examples, we can see our country holistic and integrated approach to safeguarding public health in the face of climate change, and our experience offer valuable insights and potential pathways forward for nations globally. Well, I hope this webinar provides a clear picture of our work and help to this exchange of experiences.
Thank you so much, Katia. It was really, really interesting. And also, I wanted to thank all the panelists so far, because you already touched to so many points. So from health policy and the integration and the difficulties also of intergovernmental coordination, and also finance, but also the need for nutrition lenses that Berta mentioned to really improve climate policies, but also the impact of climate change on nutrition, the issue of air quality that Katia touched upon right now, and also the main one of the really important issue is the change of the activities of disease vectors like dengue, as you mentioned, Katia. So it's a really complex problem that we are facing, and I think one of the things that you all have highlighted is that to complex problems, we definitely need complex solutions. So there is not a solution that fits all, but probably potential solutions that can look at different co-benefits. And that's something that you all touched upon, I think, in various sectors, right? So that it's you cannot think about climate adaptation as a whole. It was really interesting to me, this nature-based solution application to climate and health, because normally nature-based solutions have been used for at the beginning for mitigation and then only for forestry, but then it's great that countries are expanding their application to also a whole a lot of other sectors. All right, I see there is already a question in the chat, but right now what we are going to do is really separate in different breakout rooms. We are going to have 2 breakout rooms in English and 1 breakout room in French. The idea of these breakout rooms is really for the participants, for you, dear attendees, to engage with the participants. But we also have a bonus because in one breakout room, the English-Spanish one, we are going to be joined by Margaret Ngonga from CARE Zambia. Margaret is a climate change advocate and development coordinator at CARE with a background in media and public engagement, and she works on amplifying community voices in climate adaptation and nutrition planning, empowering including governance processes at the local level. So we are going to have with her also another perspective. She's going to share in one of the breakout rooms these her views and some of her work. So that said, I think we can move to the breakout rooms, and then we are going to reconvene, and you're going to have your panelists also an opportunity to reflect on what has been said in your session. Thank you. For the panelists, you haven't received the invitation, Katya says, but please, you can join on your own accord because you're a panelist, one of the sessions, and Katya, please join the section English with Spanish translation. Perfect. Thank you so much for these lively conversations. I'm waiting that everybody's coming back from their breakout rooms. Or are everyone already here? Can the technical team confirm that everyone left?
It's letting them, there's 79 seconds left for them to be officially closed, but people are coming back.
Perfect. Thank you so much.
Of course.
Thank you, Yassine. And as people are coming back, I wanted to share some of the highlights that we had in our session with the rest of the attendees. So before I do that, I just wanted to invite Margaret Ngonga, who is from Care Zambia, to share some of her experience regarding this connection between climate change impacts. So for example, droughts, and responses that are not only looking at making agriculture more resilient, but also making the people more able to access nutritious food. Margaret, the floor is yours for a couple of minutes.
All right. Okay. Is it okay if I turn on my camera? Okay. So great session, by the way, the breakout, very informative, and I have learned quite a lot from the other speakers. I think generally, being someone who works on the ground with communities, I think I'm going to share one story. A few months ago, I did a story in one of the southern districts of our country where this woman was collecting some of the food items that we were distributing to that particular community under our humanitarian and emergency response thematic area. And this woman told me she had not eaten for 3 days, and she was anxiously waiting for the day that CARE is coming to give out these particular food items. And she had about 5 children with one who was disabled. And this was because her crops, the previous year had completely dried out, and she literally got nothing from her field. Now, this is a single mother of 5 children with one that needs very particular attention, and she cannot just get food, but also she cannot even get nutritious food for her children. And it got me thinking, like, how many more single mothers like this particular woman do we have in Zambia that are struggling, to just put food on the table, especially after the drought? And what can we do? So in as much as we can lend a helping hand by providing them with the relief food, what else can we do for our communities? And I think that is why I'm super passionate about the CBSKL project, because it allows communities to be part of the process. And how we are working with communities in the southern part of Zambia, in Zimba district, is allowing them to come up with their own adaptation solutions. So we are doing the participatory vulnerability capacity assessments. We are doing the community action plans, adaptation plans, that they themselves are part of the process from the beginning. They know what resources they have in their community, they know what's readily available, and they know what they need in order to enhance their adaptive capacity. So it has been quite the journey. And of course, as CARE Zambia, we are looking forward to implementing this particular project in the coming month or so as we get on the ground and actually start the implementation process. But generally, how it's been for us is seeing how important it is for incorporating local knowledge, incorporating traditional knowledge into the plans that we have for the communities, for them to have a voice. So when we talk about governance structures, when we talk about financing mechanisms, we want communities to be part of that. We want them to come up with their own solutions, and then we can come in and provide that technical assistance and finance. So as previously mentioned, for those who were part of the side discussion, it's an issue of, number one, sustainability. I think when communities are part of the process from the beginning, there's a sense of ownership for them. and they get to be more involved in the process. So which means even after the project is gone, they will be able to continue with whatever it is that you had taught them in the process. So it has been great seeing that. And some of our projects have actually reflected that in the past, where some communities have actually continued with the interventions that were taught in the beginning. And 2 years after the project, they're still growing strong, and they're actually thriving despite the drought that we had in 2023. So for us, it's the locally led approach. It's the climate smart agriculture. It's including nutrition and agroecology in our interventions to ensure that communities are not just adapting, but also their health is taken care of. Because as we know, the climate risks of drought or floods, come with health risks as well. So we need to ensure that that linkage is made. And I'm happy to share that even in the conversations that we've been having with other CSO partners, the UNDP, the World Bank meeting that I attended recently, they're equally focusing on some of these issues. They are focusing on AFOLU, but also linking health, to adaptation options. So I believe as a country, we are on the right track. Thank you.
Yeah. Thank you so much, Margaret. And it's really, really great work that Kerazanga is doing, and in general, also the various ideas and commitments and actions that have been shared in the various breakout rooms were really, really interesting. And therefore, I wanted to ask the other panelists as well, starting from maybe Solomon, to give us some closing remarks from what you take away from your session and the discussions that you had in this webinar. Please, Solomon, maybe if you can give us a couple of minutes of remarks.
Yes, sure. And I'll be straight to the point. In fact, we had a lot of discussions in terms of nutrition and then how there could be sustainable financing for nutrition. And it was very, very key during our discussions. And the great takeaway is that it's not only about the health sector, it's a multi-sectorial approach. So we should get Ministry of Agric involved, Ministry of Education involved, even Ministry of Gender and Social Protection also involved. That is one. Number two, how do we ensure domestic financing for nutrition? And I think the answer was simple and straightforward. It should be government commitment. That is one. And it should be also captured in our national budget. It should be a priority, because we are having donors moving away from our country. We are having dwindling support. But once it's a priority of the government, it will be captured. There will be programs that will be captured in the national budget, and resources allocated to it to ensure domestic financing. So we talked about Ghana's case, where we wanted to talk about interventions in terms of nutrition, where we talked about the smart agric, the planting for food and jobs, the youth in the agriculture approach, that were government initiatives to improve the food security, and then also improve the malnutrition in our country. And these were all government initiatives. They were captured in the national budget, and there were resources allocated to it. Thank you.
Thank you so much, Solomon. And following up what you said, I mean, I know, Berta, you were in the same breakout rooms. Do you have any other points that you wanted to highlight from the discussion, or also from what you heard from the other panelists and from Margaret now?
Yeah, okay. Yeah, thank you very much. I think we've had really a rich discussion, case studies, examples from different countries. And I think the key issue for takeaway for all of us is that which spoke to me seriously was we are having a donor shrinking space, where donor financing is becoming leaner and leaner in African countries. Therefore, we are looking outwardly as well as inwardly to our own solutions. What are our local solutions that we can put in place to ensure that climate adaptation is grounded within the government national development plans? So the Ministry of Finance is on board, the Ministry of Agriculture, whether they are environmental, whatever ministry is there, how are we factoring this? The integrated approach will be more resource efficient than implementing in silos. So that is very important. And I think we should ensure, as we are looking at national adaptation plans, we should go beyond looking at that plan within the climate aspect, but how is it tapping into different aspects that they are all addressing the same issue, especially building livelihoods, sustainable livelihoods, resilient livelihoods for communities which are unstable due to different variabilities that come with climate issues. So that was, I think, very key for us to take to governments and broaden our engagement beyond just climate change. Thank you.
Thank you so much, Berta. And it's super interesting because also we have a question from Timothy Osoro, a journalist from Kenya, who has been working, right, with communities that are feeling the impact of climate change. And just reading what he mentioned. And the question was really on how to close the gap between the lived experience on the ground and the real issues that people and communities are facing in places like Kenya, but that's true for in all over the world, especially in the global south, and the climate policy that are sometimes drafted in high-level boardrooms, as he puts. And Solomon really mentioned this also in his first intervention. I remember when there are consultants coming and doing some work that has nothing to do with the reality, no, of the country. And I think that Margaret and Berta already answered a bit about this issue. I don't know if Katya, would you like to say have some reflection on this question? So how to bridge the gap between the community level and their needs and the national adaptation policies, or if you wanna, or if there is any other things that really inspired you today.
Thank you. Well, there are always gaps to fill with these climate actions. As we spoke during the panel or during the breakout room, it's very important to have financing of those actions, because sometimes we do a lot of planning, but the resources are scarce. So it's important to join the different financial mechanisms in order to establish how we can move forward on these adaptation actions and planning with the public investment, also with the private sector, good credits for the people that are doing their best environmental practices. I can say that one of the main points that we discussed that are important in order to fill those gaps is to establish public policies aimed to food and nutritional security, efforts that promote the transformational of agri-food systems through instruments such as one we have in Costa Rica that is named Costa Rica Towards Sustainable and Healthy Agri-Food Systems. The Sustainable Agri-Food Systems seeks to promote sustainable consumption and production and strengthen the local markets, improve marketing and traceability. That it's something that all of the markets are going to ask in the future. How's your carbon footprint? Are you implementing adaptation actions in order to access those markets? Also to guarantee access to diverse, healthy and nutritious food. Multi-stakeholder collaboration was a key point that we discussed during this breakout room. the development of roadmap for these sustainable agri-food systems that involve participatory process with the public and private sectors. Also to empower communities. It's that aim to strengthen governance, promote the sustainable agricultural practices, and encourage healthy eating, particularly in vulnerable cantons. Also, it's important the food safety and export. Public research structures are always important in order to maintain a strong public higher education and research structures in order to innovate the different practices. And also, we didn't mention that, but it's very important for the agricultural sector to have like recognitions that search, for example, for the reduction of agrochemicals on that sector.
Of course, yeah. And I think what you just, I mean, thank you first of all for this really comprehensive answer. And I think that's something that also we to complement what you said, but this stakeholder and engagement participatory approach was something that we discussed in our breakout room to answer again Timothy's question, was really the involvement of the communities in the designing of the adaptation actions and not only in their implementation, right? And we have a really final question because we are almost at time, but I think it's really important because I see that Mahesh is asking, how do we get to the low-hanging fruit of reducing from 40% the waste and loss of food to improve nutrition outcomes with limited resources? And I wanted to put Berta on the spot on this because I know that AGRA is working on food waste, right? So maybe can you share some insights about this so-called low-hanging fruit, Berta?
Yeah, thank you very much. Actually, so AGRA Regain program, reducing food loss using technology and other innovations, is a response to the same challenge that we have. Okay, let me start my, yeah, okay. Yes, sorry for that. Yes, so it is a response to the high food loss situation that we are facing as a continent. And in Regain, what we are looking at, what are the solutions that we can put in place quickly that could save not only grain, but other foods. So we are having high food losses in grains as well as horticultural products. So our approach, our solutions are basically to do with the transportation. We have innovations around transportation, how we transport food from one place to the other, the cold storage, the actual storage itself, the way farmers store their food. But for nutrition, we are promoting whole food consumption, because remember, a lot of Africans, they consume their grain after processing, after removing the bran. And that is also a huge food waste or food loss aspect, because you remove almost 40% of the food when you do that kind of processing. Also, you remove all the right nutrients and you leave that food to become just a starch when you have removed the fiber, the micronutrients, the vitamins. So whole food consumption actually facilitates or supports reducing the food loss. And for low-hanging fruits, actually, I would recommend, if governments are doing school feeding, for example, they would switch from processing their grains to allowing the children to consume the food in its whole state. That way, we are going to reduce a lot of food loss, but also supporting farmers, on the farm with really solutions that can support them to reduce the food loss. And I think this should be not only something that we are speaking from program implementation level, but as we are focusing on adaptation, how do we cultivate this aspect within our adaptation plan? It should be part of the objectives within the adaptation plan to say we want to reduce food loss from 40% to 5% as a continent. We will not be
Yes.
going into massive production the way we are doing because we are losing most of the food already. So that if that becomes intentional, then among the low-hanging fruits, we'll be looking at quick solutions that can move us from 40% to 5% in reducing food loss. Thank you.
Thank you so much, Beta, and that's I think is the perfect closure of a very, very interesting and interactive webinar. I wanted to thank you all in name of Afri Catalyst for joining. Thank you to the panelists. Thank you to the very engaged attendees. And also, again, to the team of Afri Catalyst that made this webinar possible. This is not the end of the discussion. Actually, we are just launching 3 papers on the nexus of climate and water, climate and health, and climate and nutrition, and potential opportunities for engaging in this nexus and to work on actions that actually are tackling co-benefits in all 3 of them, just like the seeds that Margaret was talking about before. This is the start of a conversation. This is not the end. We are going to have a lot of events during this year. There is the African Food System Forum in Dakar in September. In Addis, there is going to be the African Climate Summit. And then, as also has been highlighted before, the COP30 in Belém in Brazil, which is putting adaptation at the center. And we are going to advocate for having nutrition and health as pillars of adaptation and climate action. With this, I'm really happy to close this webinar. It has been great, and I hope to see many of you soon. Goodbye.
Bye. Thank you.
Bye. Thank you so much, Fabio. Thank you. Bye.
Thank you. Goodbye.